Hello everyone, welcome to sqadia.com, and now we will talk about some different types of uterine polyps. In this we will talk about the fibroid polyps, cervical fibroid polyps and placental polyps. Fibroid polyps. These are the pictures showing the fibroid polyps here, and there is a white pedicle and thinning out of the cervix. So fibroid polyps are present in this case. It's not just like a polyp, it's fibroid polyps in which it's a bigger in size also, and there is a growth of the smooth muscle and connective fibrous connective tissue. And this, on the ultrasound, you can see endometrial polyp here. This is the picture of the endometrial polyp. Again, it's a very clear picture of cervical fibroid polyps are coming out here from the cervix. You can easily see even on the direct examination. It's a cervical fibroid polyp which can be confused with the inversion of the uterus. Catheters, one in the urethra and then other in the cervical canal, is inserted. And this polypectomy is usually performed to remove these polyps. Signs and symptoms of the polyps is usually, since there is sensation of something coming down is present, there is intermenstrual bleeding, vaginal discharge, and there is colicky pain. Colic type pain which comes and goes off, its colicky pain is present. Then speculum examination. This is the speculum examination and pervaginal examination. Speculum examination reveals the size and color of the polyp, if it's pale, if it's hemorrhagic, or if attachment of the pedicle to the cervix can be visualized. So on speculum examination, we can actually see the color of the polyp, whether it's pale or if it's hemorrhaging, or attachment can be seen to the cervix. Per vaginum, usually two fingers are inserted, and then again with the pressure on the uterus, the purpose is to push the polyp or fibroid down so it can be easily palpated per PV or per vaginum. Bulky uterus is present, cervix may be patulous, tip of the polyp is felt, or the polyp is felt distinctly outside the external os. So again, it can be felt by pushing the abdomen down, and different feelings when we palpate. We can feel it may be patulous, or a bulky uterus is present, and then polyp is felt sometimes distinctly. Like in the previous picture, we saw the polyp coming out of the body or out of the vagina. So this, sometimes it is distinctly present outside the external os of the cervix. Placental polyps. Placenta is the tissue that is formed during pregnancy, and this is for the nutrition of the baby. So placental polyps. Polyps are formed on the placenta. Maybe placental polyps. So that was all about different types of polyps. Thank you for watching sqadia.com.